What can Parkinson's fighters do about sort of unexplained pain? I get a lot of that because they feel like, well, it could be soreness from the last workout. It could be injury. What can they do sort of at a home level to realize that is this an injury, or is this Parkinson's, or is this temporary?
Are you asking specifically after you're exercising, or are you asking this in general?
Well, if it's continually a lot of shoulder, a lot of elbow, a lot of hips, but then there's other ones, is there anything they can do to just kind of, all right, what is this? Is this
Yeah.
Parkinson's? Is this an injury? Or is this
Yeah.
just exercise?
Well, that's a hard question for me to answer, unfortunately. I
Yeah.
will tell you, in the Parkinson's world, pain is a very common symptom,
Hmm.
and it can manifest in a lot of different ways. What we call musculoskeletal pain, like aches, muscle aches, you know, bony type aches, like hurting in the knees, the shoulders, and the joints. Uh, that's a very common Parkinson's complaint.
Yes, that's what
Um,
I hear a lot about.
right. And the question is, how do I treat that? As you said, I also get complaints of pain, maybe from cramping. I get complaints of pain from like a twisting type movement in the arm or the leg, which we call dystonia.
Yes. Yeah.
And those treatments are going to be different. The easiest pain for me to treat as a Parkinson's doctor is pain that is Parkinson medicine responsive, or what we call dopamine responsive. And so if I have a sense that the pain seems to be breaking through and their medication is going down, or the benefit from the medicine is going down, I'm going to try and push the Parkinson medicine in some way or the other. And sometimes I can get some benefit in the pain. If it doesn't seem to be as medication responsive, that's a lot more difficult for me to treat. Um, you mentioned specifically musculoskeletal pain. I mean, a lot of times we try and treat it just like we would outside of Parkinson's disease. Parkinson's pain can be indirect, where a lot of patients are bent over from just the way they walk, and they get back pain because of that.
Mhm.
And if their posture doesn't respond from increasing the dopamine medications, then again, we're going to treat it just like they would if they didn't have Parkinson's disease. Um, so physical therapy is a big component of what we do, and that can often help with pain. Um, we use, heat, cold. Cold, you typically think of more acute injuries.
Mhm.
And you ask, is this something directly related to my exercise? It might be. A lot of times it's hard to tease out. I think the longer it goes, the more we worry there could be a component to the Parkinson's disease. A lot of time, heat is more successful if you have longer term issues. Um, Massage, I've used basic, what we call anti-inflammatories like Motrin or Aleve. Sometimes we use muscle relaxants. Um, but I think it's sometimes difficult to tell whether or not it's Parkinson's disease related, or it's indirectly related to Parkinson's. I mentioned again the posture problems. But I think, again, outside of the dopamine medications, a lot of our treatments are going to be the same regardless of whether or not you blame it on Parkinson's disease or not.